Good morning. We're here at St. John River District Hospital in the emergency room, and I'm joined by two esteemed colleagues, Dr. Ron Thies, who is the director of our emergency center, and on our stroke robot is Dr. Paul Cullis, a neurologist, and who is also the board chair of the Neurology Co-Management Company at St. John Providence Health System. Our robot assists us in treatment of stroke patients and has been generously donated by funding through the Van Alslander family, through the Neurosciences Center of Excellence at St. John Hospital and Medical Center. And we're here to provide a little education about stroke, what is a stroke, what needs to be done when you have symptoms of a stroke, and what treatment options are available. Dr. Thies, can you tell us what a stroke is?
A stroke is when there is a rapid loss of brain function due to a disruption of the blood flow to a section of the brain. There are two main types of strokes that can occur. The first is an ischemic type stroke, which is what happens, you lose blood flow to a section of the brain. This can occur due to a clot forming in one of the blood vessels of the brain itself, or you can get a clot that travels from another part of the body and goes to one of the blood vessels of the brain, making the blood flow to the brain decreased, so you lose oxygen flow to that section of the brain, leading to neurologic symptoms. The other type of stroke is a hemorrhagic or bleeding type of stroke. With this type of stroke, you can get bleeding in or around the brain that leads to similar types of symptoms, but the treatment options for the two are very different. The ischemic type stroke is actually a much more common type stroke. About 80 to 85% of our stroke patients actually have this type of stroke. The signs and symptoms that a person may encounter that may indicate they're having a stroke would be sudden onset of weakness or numbness, usually of the face or arm or leg, usually all one-sided. You may also have difficulty with speech or slurred speech or complete loss of speech, some confusion, loss of coordination, difficulty walking, or sudden onset of vision loss. Oftentimes these symptoms aren't noticed by the person themselves as much as they are noticed by family members or friends, because a person may not notice they have a facial droop if they're not looking at themselves. So family or friends may bring it to your attention that you have these symptoms going on.
Good. Now, when a patient has a stroke and they present to the emergency room, what kind of things happen when they first get into the emergency room?
When a patient presents to the emergency room, they will be immediately brought back to the treatment area if there's a thought that they're having a stroke. The nurse will start the triage process, and the physician will come to the bedside to do an evaluation, which will include obtaining a history of what the symptoms are that they've been having, how long they've been having them, when all their symptoms started, as well as doing an exam and what we call a stroke scale assessment. The stroke scale assessment, the most commonly used stroke scale, was developed by the NIH, or National Institute of Health. This allows us to use a standardized format to grade the severity of a stroke. This also allows us to communicate between healthcare professionals about a person's stroke severity, as well as to monitor their improvement throughout the treatment process. The stroke scale will assess a patient's level of consciousness, their vision, their muscle strength of their face, arms, and legs, as well as sensation and coordination. And this allows us to start the process of monitoring how the patient is doing. Once that has been completed, then the patient will get blood work and other tests will be started, including a CT of the brain. The CT of the brain is used to look not only for signs of a stroke, as well as for potential bleeding in the brain or other potential causes for them to have a stroke. Once the CT is done, the radiologist will look at it and read it, and the results will be sent back to the emergency room. We try to get all of this done as quickly as possible because many of the treatment options for stroke are time sensitive and need to be started as soon as possible. Once we have those results, then we activate the stroke network, which puts us in contact with one of our stroke neurologists through the St. John Providence Health System. Once the neurologist is aware of the patient, then we can bring the robot that you see here to the patient bedside, and they can interact with the patient, their family, and the on-site physician to do an evaluation and to make their treatment recommendations.
Great. Dr. Cullis, this brings us to you and the Stroke Network. Can you give us an overview of how the robot works in treating patients in our local community hospitals and what the Stroke Network is at St. John Providence Health System?
Yes, thank you. I mean, this is very exciting for us because we're able to provide state-of-the-art stroke treatment to patients even in smaller hospitals which normally would not be able to provide such treatment. What happens is that your hospital or another hospital in the region contacts us, and the person who is on stroke call answers usually within a couple of minutes, certainly within 10 minutes. We activate the robot, which is the device that you can see here. And this is a little bit like Skype, but it actually is a very good picture quality, which allows me to see very close up what the patient looks like, but also it allows me to control the camera and pan and zoom so that I can see exactly what I need to see. This allows us to basically come into the emergency room remotely from wherever we are and to help you in performing a consultation on a stroke patient and allowing us to recommend treatment. We like to be called when the patient comes in within about 9 hours of having a stroke because that's the window in which we can offer some effective treatment. Obviously, the most important treatment for stroke is called TPA, which is a clot-busting drug, which breaks up the clot in the brain. It's administered through an IV, but it has to be used very quickly. The original time window for TPA was 3 hours. We've now extended that to 4.5 hours. Since it takes about an hour to process the patient and get the treatment given, the patient really needs to get to the emergency room within about 3.5 hours. You then will have seen the patient. I can remote in, we have a CAT scan report, and we can decide whether the patient is a candidate for TPA. If the patient is a candidate, then you start the TPA treatment at your facility, and then the patient is transferred to our facility to a larger hospital by ALS ambulance with the TPA running, and that's a process that we refer to as drip and ship. In other words, the TPA is started there, it's continued, the patient comes to our hospital. In order to give TPA, you have to have a neurosurgeon readily available because there is a small chance of bleeding from the TPA, and if that happens, then neurosurgery may become necessary. And so what we like to do is start the TPA in your emergency room and transfer the patient to our facility. We have robots at various places in the area, and that list is quickly expanding. The next closest location to you is Mackenzie Hospital in Sandusky. We also have robots in various other places, including Carson City, which is about an hour north of Lansing. And we have a very busy robot at Genesis Hospital in Flint, which is another Ascension Health Michigan hospital, where we're seeing several strokes a day by robot. So basically that allows us to provide the same state-of-the-art treatment for stroke in any emergency room that has this facility, which allows patients even in smaller towns to receive the same treatment.
Good. So it behooves the patients, as soon as they recognize those signs and symptoms, as Dr. Thies has outlined, to get to the emergency room as soon as possible so they can be evaluated and plugged into the system. Now, if we have somebody that...
That's very important, and it's very important for them to come to the nearest facility that can provide that treatment. In the past, people have been taken by ambulance long distances to larger facilities, but the advantage to a patient that lives in your area is that if they come to your emergency room and we robot in and treat them remotely with your assistance, they can get the TPA started very quickly and they have a better chance of a good outcome. That's better for the patient than taking them to a much larger facility that's more remote before the decision is actually made.
Good. And TPA works better if it's given sooner than later?
Much better. Given in the first hour, it works much better than the second hour or the third hour or the fourth hour. Up to 4.5 hours, it's still an effective treatment. But certainly if you got it during the first hour, it would do a lot more than if you got it during the second or third hour.
Good. Now, if we have a patient that presents to the emergency room and they're evaluated by Dr. Thies and his staff and they get here beyond that 4-hour window of opportunity, are there other options available for treatment for that patient?
Yes, sir. If the patient has a a stroke that doesn't show any significant abnormality on the CAT scan, they may be a candidate for endovascular treatment up to 9 hours. That patient would be transferred to one of our facilities and would have some special CAT scan testing done called a CT perfusion study. And if that shows salvageable brain, then one of our endovascular neurosurgeons would immediately go in and provide some more advanced treatment. The things that might include would be intra-arterial TPA. That same drug, TPA, the clot-busting drug, can be given directly into the blocked artery in the brain using a wire. The neurosurgeon puts the wire into the tube, into the artery in the groin, and advances it up into the brain, into the blocked artery, and injects TPA directly. This may be a viable treatment even for patients who come in earlier who have some contraindication to TPA. For example, if you're on warfarin for atrial fibrillation, that might stop us from being able to use TPA through an IV, but that patient would still be a candidate for intra-arterial TPA. Other treatments which might be beneficial would be some form of mechanical removal of the clot. There's a thing called the Mercy retrieval device, which is kind of like a small corkscrew that can be put into the clot to pull it out. There are a couple of aspiration devices where you can actually suck the clot out through the tube. And very recently, a trial was just concluded using a stent retriever. This is a kind of a mesh device which can be expanded into the clot. The clot becomes ensnared in the device, and then the device can be pulled out. So what we're offering, if we can, to patients past the window who aren't candidates for TPA, is this form of mechanical removal of the clot, which could be done up to 9 hours, depending on how the brain is looking on more sophisticated testing.
Great. Now, is there anything new or any new things on the horizon that might also be offered to patients that come in with stroke symptoms?
Yes, we're involved in a research study in which we're using a new agent which might be effective up to 9 hours. It's entirely research. There's no guarantee of effective treatment. But what we would like to do would be to find something like TPA that could be started in your emergency room, which would have a much longer window. And so we're embarking on a clinical trial about that, and I'm sure that other trials will be coming down the pipeline. So certainly whenever such trials become available, we will consider enrolling patients from remote locations where the treatment can be started early and then the patient can be transferred. So we're very excited about this. 20 years ago, there really was no treatment for stroke. We just basically watched the person and tried to make sure that they did as well as possible, but we really didn't have any treatment. With the advent of TPA and these other treatment modalities, this has become a very exciting area in neurology and in medicine, whereby the neurologist and the emergency medicine doctor can work together to provide effective treatment for this, which is the most disabling disease that human beings get. There's more disability from stroke in the United States than any other illness. And so we're very excited about being able to actually provide effective treatment to our patients and by robot to your patients.
Wonderful, wonderful. It's exciting times that we are in medicine, or we're experiencing in medicine. I remember not too long ago, as you said, 20 years, probably sooner than 20 years, that people with strokes would come in and we'd kind of evaluate them, let the dust settle, and kind of rehabilitate with what was left there. And people were left with big disabilities. So, thanks to you and your team and the research that you do, and also the efforts that you provide to community hospitals such as ourselves to make sure that we provide state-of-the-art care to stroke patients. Dr. Thies, anything you want to say to the community, to the kind of a driving home point that they need to have?
I would say one of the main things that I would want to get across to the community is, if you think you're having a stroke, to present early to the emergency department. All too often people think, well, I'll just wait and see if I get better, or I'll go to bed and I'll see if I can sleep it off and I'll be better in the morning. And then they get up the next morning and they still have the same symptoms. So then they present to the emergency department the following morning. Unfortunately, with a lot of the treatments that Dr. Cullis was talking about, many of them are very time sensitive, and we have certain time frames that we can give them in. So if you've slept them off throughout the night, tried to sleep off your symptoms throughout the night, You come in the next day, we're out of the window of many of these treatment options. So we're left with very few options as far as doing things to try and help your symptoms now, other than, like you're saying, trying to do physical therapy and rehabilitation to try and improve your outcomes after that. So I'd say for anyone who thinks they're possibly having a stroke, to err on the side of caution and present to the emergency department as soon as possible, and try to know as close as you can to the time of your symptom onset so we can start treatment in a very timely fashion.
Good. We didn't touch on
I would just like to emphasize that one of the expressions that we use, which I think is appropriate, is time is brain. For every minute or two the treatment is delayed, millions of brain cells will die. And it's very important when patients think they're having a stroke, whatever symptoms they're having that are neurological that make them think they're having a stroke, whether it's facial weakness, drooping of one side of the face, weakness in their arms, whatever those symptoms are, it's very important that they come to an emergency room immediately that is appropriately equipped, because for every minute that they wait, millions more brain cells dying. Time is brain.
Good point. Very good point. The one thing we didn't talk about is prevention, and I'm sure both of you will agree with me that it's very important that patients, especially older patients over 50 who are at risk for stroke, see their doctor on a regular basis for an evaluation. They get their blood pressure evaluated, and if elevated, treat it. Follow a well-balanced diet, exercise on a regular basis, have their cholesterol assessed and treat that as well, so they reduce their chance of having a stroke. Anything to add
And
to
no
that?
smoking. No
There you
smoking.
go. I forgot that, and that's a very important one. Good.
As well as
It's a big risk factor.
Yes, it is.
diabetes also puts you at a higher risk in making sure, if you are diabetic, to treat your sugars and make sure you're having good control of your sugars as well.
Good points. Good points. All right. Well, I wish to thank both of you for helping us today and providing an overview of stroke, its treatment, and what we have available, and also our stroke network through the St. John Providence Health System. And that concludes our presentation.
For a physician referral, call 866-501-DOCS.